Endoscopic versus open spine surgery, the honest truth about back surgery. For anyone suffering from a herniated disc, severe sciatica, or chronic back pain, daily life can become a constant struggle. When physical therapy and medications stop providing sufficient relief, spine surgery may be considered to reduce pressure on affected nerves. Modern spine care generally includes two major approaches: traditional open spine surgery and minimally invasive endoscopic spine surgery. Understanding the differences between them can help patients make more informed treatment decisions. Let's start with traditional open spine surgery. This approach typically requires a larger incision to access the affected area of the spine. To reach the disc or bone, surrounding muscles may need to be moved aside, providing the surgeon with a broad view of the spinal structures. This can be particularly useful in complex spinal conditions or multi-level fusion procedures. However, the larger surgical exposure may result in increased tissue disruption, longer hospital stays, and a more extended recovery period compared with some minimally invasive techniques. This is where endoscopic spine surgery has transformed many aspects of spine care. Instead of a larger incision, the surgeon uses a very small opening through which a slender tube equipped with a high-definition camera and specialized instruments is inserted. By working through natural tissue planes, the surgeon can access the affected area while minimizing disruption to surrounding muscles. The procedure is performed while viewing magnified images on a monitor, allowing precise treatment of selected spinal conditions. Because tissue damage is minimized, postoperative discomfort may be reduced, blood loss is typically lower, and recovery can be faster for appropriately selected patients. Many patients are able to walk within hours of surgery, and some procedures may be performed on a same-day discharge basis depending on the individual case. Financially, advanced spine procedures can be extremely expensive in Western countries, with costs sometimes reaching tens of thousands of dollars. This has encouraged many international patients to explore treatment options in India. JCI-accredited spine centers in India utilize advanced endoscopic technology and internationally trained neurosurgeons and orthopedic specialists, offering modern spine care at significantly lower costs. Ultimately, the right approach depends on the nature of your spinal condition, imaging findings, overall health, and the recommendation of your spine specialist. Always consult a qualified spine surgeon and undergo a detailed MRI evaluation before making treatment decisions. Knowledge is your best tool when protecting your mobility. Subscribe to Cure in India for more honest, data-backed medical insights and healthcare guides.